Hi class, my name is Diane Richards and our group will be presenting on eating disorders. The presentation will include information from Stephanie, who will be speaking about anorexia, Danielle, who will be speaking about bulimia, and Ross, who will be speaking about binge eating. However, in the DSM-5, you'll find that feeding and eating disorders actually include more conditions, and those are pica, rumination disorder, avoidant restrictive food intake disorder, and then anorexia nervosa, bulimia, and binge eating, as I mentioned. So some of the characteristics of eating disorders include a severe impact on one's um, ability to have a healthy body image to the point of behaviors which include, behaviors which impact healthy functioning, physical well-being, mental well-being, psychosocial health, pretty much when somebody has an eating disorder, their thoughts are consumed with their weight and calorie intake and things like that to the point of not really being able to think about much else. So in this presentation, some distinctions will be made between the three conditions that we are discussing. But it's helpful to note that in Francis's book, sort of reviewing the DSM, since it's been edited for the DSM-5, he makes a note that binge eating in particular is kind of a complex diagnosis or condition to diagnose, given that binge eating is a common human experience. And I think that is worthy of reflection. Knowing that some of these other disorders might have more clearly marked outcomes. So for anorexia, you might consider the weight of a client, noticing that there's a severe, that they're severely malnourished and underweight for their height and body mass index, which would be an appropriate body mass index. And similarly differently, those folks who have experienced bulimia you may not notice right away because they might have what appears to be a more normal body weight. So, or even an overweight, even being overweight for their size. So just some things to sort of think about when characterizing these qualities, and I'll let the rest of our presenters take it over. Thank you so much.